Every time I need a break, I just love watching K-dramas to make me feel better. How about you? What's your go-to food, movie, things to do whenever you want to take a break? Well, it's important to always take care of your health. And this is how I do it, especially when it comes to mental health. But this morning, I'm not going to talk about my mental health story. Instead, we're going to tackle on employees' health in general, particularly the background, importance, definition of salient terms, concepts, functions, related laws, and practices in the public and private setting. A great morning to each and all. I am Marty Del Mugot and I'm here to discuss employee health. As Paul Dressler said, good health is good business. For an organization to succeed in its endeavors, its employees must be fit and healthy. For great workplace productivity, the health of the employees is one of the determining factors. Health is a state of complete physical, mental, and social well-being. To live a healthy life, people need to have a balanced diet, exercise regularly, and get enough sleep. They must also live in a stress-free environment and have good hygiene. Creating a work culture that promotes health through all aspects of the employees' lives has various health benefits. They can be fit, healthy, satisfied, and happy. Emphasizing employee health and well-being is very important. It contributes massively to overall employee engagement within the organization. Now, what does employee health mean? Employee health is a term used to describe the overall health of an organization's employees. It encompasses all aspects and dimensions of health and wellness, including physical and mental health. Employee health or employee well-being is one of the most critical aspects of an organization. Health employees are widely considered as the pillars of organizational success. Many employers worldwide realize this and put the health of their employees first by introducing various wellness programs and activities. Well, here in the Philippines, the Occupational Safety and Health Standards was promulgated for the guidance and compliance of all concerned by virtue of the powers vested in the Department of Labor and Employment under Article 162 of the Labor Code of the Philippines. The OSHS was formulated in 1978 in compliance with the constitutional mandate to safeguard the worker's social and economic well-being as well as his physical safety and health. The objective of this issuance is to protect every working man against the dangers of injury, sickness, or death through safe and healthful working conditions, thereby assuring the conservation of valuable manpower resources and the prevention of loss or damage to lives and properties, consistent with the national development goals and with the state's commitment for the total development of every worker as a complete human being. Well, these standards shall apply to all places of employment except as otherwise provided in this standard. Now, what are the general provisions? Every employer shall establish in his place of employment occupational health services in accordance with the regulation and the guidelines provided for under this rule. And the employer, the workers, and the representatives where they exist shall cooperate and participate in the implementation. In terms of its coverage, this rule shall apply to all establishments whether for profit or not, including the government and any of its political subdivisions and government-owned or controlled corporations. And in terms of dental standards, the Bureau of Dental Health Services of the Department of Health shall be responsible for the development and enforcement of dental standards. Now, the following terms are defined in this rule. The occupational health services, which are the services entrusted with essentially preventive functions and responsible for advising the employers, the workers, and the representatives in establishment or undertaking of the following: First, letter A, the requirements for establishing and maintaining a safe and healthy working environment. And letter B, the adaptation of work to the capabilities of workers in the light of their state of physical and mental health. Another term that we need to remember in this rule is the occupational health personnel. It is an establishment or undertaking refers to the qualified first aider, the nurse, dentist, or physician whose service or services have been engaged by the employer in order to provide occupational health services in the establishment or undertaking. Now, the following are the functions of occupational health services. Letter A, identification and assessment of the risks from health hazards in the workplace. Letter B, surveillance of the factors in the working environment and working practices. Letter C, advice on planning and organization of work. This includes the design of the workplace, on the choice, maintenance, and condition of machinery and other equipment, and on substances used in the work. Next is the participation in the development of programs for the improvement of working practices. Another one is advice on occupational health, safety, and hygiene, and on ergonomics and individual and collective protective equipment. Another one is surveillance of workers' health in relation to work, promoting the adaptation of work to the workers, collaboration in providing information, training, and education in the fields of occupational health and hygiene and ergonomics, organizing of first aid and emergency treatment, and participation in analysis of occupational accidents and occupational diseases. Now, in terms of emergency and health services, we have under this service the medicines and facilities. So, every employer covered by this rule shall in his workplace at least minimum quantity of the medicines, medical supplies, equipments, and medical faculties listed in the table 47, which I will be showing you in the next few slides. So the medicines, medical supplies, and facilities may be substituted with comparable medicines or facilities as prescribed by the occupational health physician of the workplace. And number 3, the medicines, the supplies, and facilities shall be kept inside the treatment room or medical clinic, and it shall be replaced with the same quantity immediately after use or consumption. Aside from that, every employer covered by this rule shall also be provided with medical and dental facilities, depending on the cases or the manner. Next, an employer may not establish an emergency hospital or dental clinic in his workplace as required in these regulations, where there is a hospital or dental clinic which is located not more than 5 kilometers away from the workplace, if situated in an urban area, or which can be reached in 25 minutes of travel. However, if it is situated in a rural area and the employer has facilities readily available for transporting workers to the hospital or clinic in case of emergency. Now, what are the duties of the employers? It is their duty to establish in the workplace occupational health services to provide a healthful place of work. Next is that adopt and implement comprehensive health program for his workers, enter into a contract with hospitals or dental clinics if these are not available in this workplace, and maintain a health record of his programs and activities and submit an annual medical report. The employer shall organize and maintain an occupational health program to achieve the following objective. First is assess the worker's physical, emotional, and psychological assets. Number 2, protect employees against health hazards in their working environment. 3, provision for first aid, emergency services, and treatment. Number 4, assure adequate medical care of ill and injured workers. 5, encourage personal health maintenance and physical fitness and proper nutrition practices. And provide guidance, information, and services for family planning programs. Now, the health program shall include the following activities: maintenance of a healthful work environment, and of course, health examinations entrance, no, the entrance examination for health, periodic, special examination, transfer examination, and separation examination. Another one is diagnosis and treatment of all injuries and occupational and non-occupational diseases. Another is immunization programs, then accurate and complete medical records of each worker starting from his first examination or treatment, which must be under the exclusive custody and control of the occupational health personnel. Number 6 is that health education and counseling, in which the occupational health and safety personnel shall cooperate with the supervisors in imparting appropriate health and safety information to the employees. And lastly, nutrition program, which shall be under the dietitian and supervised by a physician if the latter is present. Aside from that, these are some of the things to remember in terms of the physical examinations. Like all workers shall undergo physical examination before entering the employment, periodic, when they are transferred or separated from employment, and even when they are injured or ill. And all examinations shall be complete, rendered for free, and include X-ray or special laboratory examinations. So the results of these physical examinations shall be recorded carefully, and then the records of physical examination and all information obtained shall be considered strictly confidential. Periodic annual medical examinations shall be conducted in order to follow up previous findings, so to allow early detection of occupational and non-occupational diseases and determine the effect of exposure of employees to health hazards. Now, there are different health benefits in private and public sectors in the Philippines, but one thing in common to all organizations is that they offer PhilHealth services. So health benefits are institutionalized, which means that it really depends on the companies which benefit or health benefits they really offer. So some organizations are provided with HMO benefits and some have none. Same in the public sectors. It really depends on the company. Now, here are some examples of good health practices in schools or in any organizations. Healthy services, just like school-based access to preventive services, referrals, emergency care, and chronic disease management. Another is counseling, psychological, and social services. This actually focuses on the cognitive, emotional, and behavioral needs of every individual. And then nutrition services and education. This includes developing a whole school food policy, providing clean and cool water fountains, offering healthy foods in school canteens, and developing a school vegetable garden. And then also physical education activities that would enhance physical fitness, like scheduling more physical education or activities, and ensuring that adequate time is spent on developing fundamental motor skills. And lastly, comprehensive health education, which is developmentally appropriate K-12 curricula that develops health knowledge, attitudes, and skills taught by certified health educators. So employee health plays a direct role in the overall success of the organization. It determines how well an organization is equipped to meet adversity and overcome various challenges. Healthy employees are more likely to perform well and be more productive than the sick, unhealthy employees. Such employees are also less likely to fall prey to health problems and incur fewer healthcare costs for their employers. Not just in terms of profits and savings, employee wellness can also improve an organization's image in the eyes of its customers and competitors. Encouraging good health among the employee is very important. Doing so will increase productivity to a great extent, and it will help the organization thrive. Also, the overall well-being of the employees will display on its own. The rationale of employee health is to allow employees and the organizations to adapt and thrive in adverse situations. It is to foster a positive working environment where employees learn and grow as individuals for the betterment of the company. Now, to sum it all up, here are the benefits of a healthy workforce: increased productivity, reduced absenteeism, reduced healthcare costs, improve work culture, enhanced company image, increase work satisfaction, reduce workplace stress, increased job retention rate, and increased employee engagement. That ends my discussion. Thank you so much for listening, and don't forget to stay healthy.